As you get older, you have problems with your feet, and that's where Dr. Bowers came in. I went to several other podiatrists up in North Dallas, which, if you're in North Dallas, you're an affluent part of the city, and you would think all the doctors up there are the best. And that didn't work for me, so I wound up over in Mansfield at a podiatrist's office over there, and I sit and I visit with him. It didn't work. So Dr. Bowers was on the list. I got approval to see her, and she's a physician here. The lady sit down and I told her what was going on with me. She talked to me, she explained a lot of things that these other podiatrists did not explain to me. Well, she talked to me in my language, in the language that I could understand. So that's been about a year ago, so I haven't changed yet. But the doctors here are excellent. And most of them I've met either in some kind of conference or talking with them one-on-one. So, and reading the bios, you would think, man, this is some of the best doctors around.
Good morning, Mr. Allen. How's it going?
Doctor, I'm fine, and you?
I'm doing great, but I want to find out how your feet are doing. Now, we went through a list of things that you were supposed to be doing and following up on with the treatment plan. Have you been following the instructions with using the medications and things?
Yes and no.
Yes and no?
Yes and no.
Explain.
Well, some of it gets a little tedious, but then I remember Dr. Bowers said, do this, or you'll have this, do this, or we might have to amputate. So
That's
those are
true.
words to remember.
Right, because being a diabetic, we know that it's very important for you to keep them clean, follow the instructions, and be sure to keep your appointments because it's a team effort. I can give you the instructions, but if you don't follow them, there's not a whole lot we can do. But if we work together, we can keep you and these feet healthy, keep them in order, so that we don't end up with amputations, correct?
Correct.
Okay. So are you okay with your refills and things?
Yes, I am.
You are, okay. Now, can you tell me any of the treatments that worked better? Or was there something that worked better than something else, or you need something to change?
Well, as I said before, the trust is between the patient and the doctor, and I do trust you, so the meds that you give are topical, so I don't have to take anything, and they're working fine, especially that aspirin cream. I've never used it before, but I used it on the gout, and no pain in the knee.
Oh,
And
okay.
it's working.
See, I told you it would work.
You did.
I told you that.
You did.
Okay, and what about the medication you're saying for the nails? I know it was working kind of slowly.
Well, the nails, that was kind of uncomfortable. It smelled like lacquer, so I didn't use it. So that's one of the instructions I didn't follow.
Okay.
Didn't use rather.
I know it doesn't smell good, but it's not about the smell, right? We still have to go through the process because the pills we don't want to give you. You don't want to take any oral medications if you don't have to. And the topical will work and may not be perfect, but we can get some improvement with just following instructions. So you know how I say sometimes you can't be hard-headed. Okay? So
So far everything you've said was right, and I've been to several other, and I mentioned this to you before, podiatrists, and it just didn't come out the way you said. You made it simple. For me, it's complicated because I didn't want to follow instructions. Old school. So, but sometimes it's hard that folks will listen, especially if they have trust in the doctor, and I have trust in you, doctor.
I'm so happy that you trust me because now I trust you and we're a team.